Hi everyone, my name's Javier and I will be giving a presentation on Obsessive Compulsive Disorder. All right, let's get started. Recognize anyone? I hope so. Can you guess which of these 6 celebrities have OCD? We have Cameron Diaz, David Beckham, Jessica Alba, Leonardo DiCaprio, Justin Timberlake, and Howie Mandel. As you probably figured out, all 6 of these celebrities have OCD. So what is OCD? Obsessive compulsive disorder is an anxiety disorder characterized by unwanted thoughts, the obsessions, and repetitive actions, compulsions. However, OCD is different from OCPD. People with OCD have insight, meaning that they are aware of their unwanted thoughts and how unreasonable they are, whereas people with OCPD think that their way is the right and best way, making them feel comfortable with their self-imposed system of rules. OCD is commonly mistaken with preferences and organization. Just because you like to color code and alphabetize does not mean that you have OCD. People who have OCD have little to no control over their obsessive thoughts and compulsive behaviors. It's time-consuming. The disorder persistently interferes with everyday living and causes the person distress, making effective functioning almost impossible. People assume OCD means cleanliness, but in reality, there are cases where compulsions include hoarding items, checking and rechecking over and over again, but nothing changes. So what causes OCD? Well, we don't really know. OCD can be considered a neurobiological disorder relating to the biology of a person. It can also be linked to environmental factors. Some elements, like infections, are suggested to have triggered OCD. So whatever you do, don't drink the water. Just kidding, it's all good, unless it's Arrowhead. Nevertheless, scientists have not found a main cause of OCD, but they have discovered some treatments to help OCD patients. So how do we treat it? The obsessive thoughts and compulsive behaviors that become with OCD cross the fine line between normality and disorder. Treatments OCD patients are using only reduce their symptoms and are not curable. There are 2 types of treatments commonly used: the behavioral therapy, which gradually desensitizes patients to their anxieties, and then medications. OCD is treated by drug therapy. There are so many drugs people use for their OCD, such as Zoloft and Prozac. And as you can tell, there is another treatment. However, it is extremely uncommon: electroconvulsive therapy, but that's only in rare cases. Today I explained what OCD is, what could cause OCD, and how to treat OCD. It may not be a widely diagnosed disorder, but being well informed isn't such a bad thing. If you believe you are struggling with OCD, I sincerely ask you to speak to your doctor. You should be in charge of your obsessions, not vice versa.